Step number 1 is to be mindful of the carbohydrates or sugars that you're consuming, especially liquid sugars. Liquid sugars spike blood sugar a lot harder and a lot faster and are going to raise that insulin a lot higher, so it's going to stay high a lot longer and keep yelling at the cells. So we really are going to have to lower our carbohydrate consumption in order to get our insulin to come down. Now that doesn't mean that you can't have any carbohydrates, but if you're leaning towards a type 2 diabetes type insulin resistance, when you're eating carbohydrates, you're basically bringing in a food that your body can't process correctly. So anything that the body can't process no longer becomes a fuel, it becomes a burden that the body has to deal with and figure out how to get rid of. So if you can't process those carbohydrates very well, it's not really doing you a lot of good to bring so many in. So we really want to bring those carbohydrates down so that insulin can come down, stop yelling at the cells all day long, and eventually the cells can be more receptive to insulin. You become more insulin sensitive. Now, step number 2 is to fix any digestive symptoms. If you're dealing with any issues like burping or bloating or acid reflux or constipation or diarrhea or nausea, or maybe food just kind of sits there in your stomach like a rock for hours, all of these are signs that digestion is not working correctly. And when you can't break down protein correctly to use that, and you can't emulsify or break down our dietary fats so the body can use those, then your body's really going to scream for carbohydrates. So if you're going to lower your carbohydrates, you're going to need to increase your protein and fat intake. And if you can't digest those correctly, this will not work for you. You will absolutely be miserable. You'll gain weight. You'll yell at the mailman because you don't like the shorts that he's wearing. It's all going to be a horrible situation and you're going to quit. So if you have any type of digestive symptoms, you really need to fix those. Step number 3 is to fix any carbohydrate or sugar cravings and reduce the stress that the body's dealing with. If you're having a lot of cravings for carbs and sugars, there's usually a reason for that. But if there's a reason, you're going to have a hard time reducing these carbs without going nuts and finding yourself knee deep in a bag of donuts before you even realize that you're eating donuts. So we really have to fix these cravings. And the most common cause for cravings is low blood sugar and low mineral levels. The body really needs minerals to send signals through and to help a lot of the functions of the body take place. And without those minerals, the body can use glucose to kind of take the place of some of those minerals. So if mineral levels are really low, the body's going to scream for carbohydrates and sugars for sort of a quick fix. So you can look at your blood pressure at least 2 hours after a meal, but not first thing in the morning. It should be after a meal. And if that systolic number, the top number, is less than 112, that's a really strong sign that there's not enough minerals in the system for the body to function the way that it wants to function.